My name is Natalie, and I am 41 years old. Things that I like to do are mostly spending time with my children and my loved ones. My daughter is Bryn, she's 7 years old. She's blonde and spunky and lots of fun. My son is 10, his name is Kai. He's an avid climber, and they're just the light of my life. I was diagnosed with cancer the first time, December of 2012. The first day I found it, I was sitting on the floor and I had a tickle in my armpit, and I reached around to just feel it, and I felt a small lump. The next day I saw my friend, who's also my OB, up in the operating rooms. She sent me for an ultrasound. We waited for the pathology report to come back. Then it was confirmed. First things I thought about my kids because they were so young. My daughter was only 2.5. My son was 5.5. I thought about what it would be like for them if I wasn't around. It gives you something to fight for. It does. The first physician I worked with was Charlie Elboim. He saw me almost immediately, and at that point we started really planning what we were going to do. I wanted this aggressively treated, so the choice was made between us to proceed with a bilateral mastectomy as soon as possible.
My name is Dr. Charles Elboim. I'm the medical director of the Anna Dell Breast Center here in Santa Rosa. So Natalie came in with a complex series of problems. She came in with a high-grade, aggressive-looking cancer, which means we couldn't use anti-estrogen pills. We couldn't use HER2/neu therapy. That left us only with chemotherapy. The next step was to refer her to a medical oncologist, and she saw Dr. Jared Holmes of medical oncology, who started her on a course of chemotherapy. I
finished chemo, and then we thought I was in the clear. January of 2013, Dr. Holmes found the second lump.
And so Dr. Holmes gave her a new combination of chemotherapy agents, and fortunately the cancer melted away.
We couldn't find the lump or any sign of it. All of the biopsies that we took during surgery came back negative, and it's been gone ever since. I'll never forget showing up to have lunch with my best friend. I had my wig on, and I was so self-conscious about wearing this wig that I said, "Do you mind if I take this thing off?" And he said, "I don't care if you take that thing off. In fact, give it to me."
Natalie is a special person, and I tell patients that I feel my responsibility is not only to take the cancer out, but also to get them back to being themselves again.
I'll never forget how hard Dr. Elboim fought to save my life. He's a dear friend. It was a journey, and it was a battle for both of us. He did everything he could to save me, and it worked. I'm a survivor.